Lead, and Dave's presenting today with Dr. Maurice Smith, who's a GP member of Liverpool CCG and chair of Liverpool MI as well. So they're going to talk about the work that they've been doing with the More Independent programme and the technologies that they've been using to achieve better outcomes for patients and people. Thanks, Dave.
Thank you. Good morning. So I'm going to talk to you about the More Independent programme. And as Graham mentioned before, we're actually also part of the National Dallas programme. So we're one of the 4 seeds, but more locally in Liverpool. Now, I'm not going to bore you all talking about... Oh, I've got an extra Y on the end of there. I'm not going to bore you all talking about the whole programme because we don't just do technology. More Independent is actually about following everything through from communities and individuals right through to the technology at the other end. So we're going to focus just today, because we're short on time, to just about the technology work that we've been doing around telehealth and telecare, and we're going to try and fit that into the next 2 hours. You've gone a bit pale there, Liz. So first of all, I'm just going to talk to you about MI, and then we'll move on to some of the technology, the general technology that we've been involved in. Then a little bit about the telehealth and telecare, and then Maurice is going to take you through around how we've tried to integrate that and what that's meant for us, and then really what next and where we're going. So about these slides haven't come across well, have they? So it doesn't normally look like that, but what we're about generally is exactly what the Dallas programme is about. So it's delivering assisted living lifestyles at scale, and it's the scale bit that we've been working on, because that's the bit that we've always found really difficult. There's lots and lots of technology out there, there's lots and lots of services out there, but the big issue that we've always focused on is how do we get that to scale? We've got 20 people using that, 30 people using that, but we've got 500,000 people in Liverpool. How do we get this built up? So MI is actually about bringing together all of the different services in the communities and how we build technology around that, not the other way around. So it's not about the technology. We're actually a technology programme that doesn't focus on it. We worry more about the people and the communities, the professionals and the services, and how those tools can fit in to that underneath. So the technology itself, we do a lot around telehealth and telecare. But I've got a real bugbear around this, and I hope there's industry listening now, because what we're not interested in and what we've learnt our lessons about is we don't want one solution. I don't want a massive computer system or gadget that can do everything for everyone. So please stop trying to invent them. They don't exist. What we're looking for is something that does the right thing for the right people really well, and then can talk to the other stuff that does that job really, really well. And that's what we're working towards. And it's actually getting the right technology and the right services linking together. And that, for me, is what we can achieve going forward, not the gadget or the chip that we're going to put in the back of your neck at some point that can do everything for you. So, the different technologies, we've defined our telehealth and telecare very differently. In fact, we tend not to use the terms telehealth and telecare, certainly not to the public. We tend to use care technology and health technology much more generally. And as you can see up there, some of the technologies relatively traditional, not always happy with it. I hate the body-worn stuff, because actually, if you're suffering from dementia and you forget to put it on, it's a bit of a waste of time. So again, and actually a lot of the people using this technology do have to live with dementia. So actually, when we're asking to keep putting it on, it's a problem. So what we're starting to look at is what can we do that's more ambient for those kind of people? And how can we really support those parts of our community with that kind of technology? But also, what other technologies do people need to know about that can help them? And one of the ones up there, my favourite one, is the one-cup kettle. Yeah, they're in John Lewis, they're in Argos. Is it assistive technology? Yeah, of course it is. Because if your hands shake and you can't pour a kettle without burning yourself, they're great. So again, we're looking at a much wider range of technology than just those things that we traditionally thought of as telehealth and telecare, because actually that broader range can make a much bigger difference to a lot of our people in the communities. So, There's also a bigger picture for us, which is around information. So it's not just about the gadgets, it's also about how we share some of that information that those gadgets and actually the health service generate for people. So what we're working on at the moment is what we call person-held record, which the person bit's really key. Now, there's been lots of debates previously around actually should you access your medical record and those records that your doctor creates for you. And a lot of clinicians quite rightly worry about that because it's kind of important, that information, you know, all that medical stuff, and should we be letting people just tinker with it? You know, oh, I could do with a few milligrams more of that, might just pop that in my medical record. Maybe not. But what we're talking about is actually allowing people to access their information and do what they want with it, and then open that up to the marketplace that's actually much faster to react to and much better at understanding those customers than we are. So what we're building is a person-held record, which can actually take a copy of your medical record and let you do what you want with it, which makes me nervous, I've got to say. But if you want to, you can have your medical record and post it on Google. It's your information. Fair enough. Wouldn't recommend it. Don't really want you to do that. But at the end of the day, it's that person's, that individual's information to do with what they will. And then we're providing them with a marketplace of different applications that the NHS is not designing for them. We're going to allow the marketplace, our SMEs, even our teenagers coming out of university, coming up with great ideas, to allow them to design the apps that can use some of that information to really support people. Why? Because they're much closer to it and they can move much faster than we can. I can do lots of program plans for you about apps that we can create, and by 2018 we'll probably have a really good one. But the marketplace can provide it much quicker and actually react far quicker. Facebook, Twitter, which is next, I don't know. But that's the pace at which it's going, and actually we can't move at that pace. But what we can do is provide the platform for the market to actually deliver that for people and open up a bit to that, to allow people to actually really use that information properly. So moving on to telehealth, I'm going to hand over to Maurice in a minute, but just to go through the key, yeah, you're excited there, Maurice. As we've gone forward with telehealth and telecare, we're quite excited at the scale that we're starting to hit. So in a year, we've managed to hit now over 1,000 patients now going on to telehealth systems. Now, our supplier, who at the moment, Philips, tells us that's the biggest and quickest across Europe. And the programme now has been awarded reference site status for the European Commission, so we're now being looked at as how we do that. So the exciting part of that is, here we are in the northwest coast, and actually Europe's looking at us. And that's not just what we're doing at MI, it's actually about all the different things that are going on here. And we're doing a lot of exciting things. We're talking to Lancashire at the moment about how our different ecosystems and PHRs link together, because actually we want to be the first and the best and the biggest at it. And that's quite exciting. So we've got that opportunity, and what we're starting to do now is share some of those lessons from getting to scale. Because actually some of the problems that you have when you're starting to put technology in completely change when you've got hundreds and thousands of people using that technology. Like, oh dear, I didn't realise you had to have more people to monitor 600 people at one time. So there's some key rules that we've managed to find out about that, which is don't generate more work for busy people. Now, it sounds really obvious, but actually, when you start to go in and you talk to clinicians and people like that, and you say, we've got this really cool system, if you can just add another 10 minutes onto your consultation time, we'll get it spot on. No, not going to happen. So the point is, you've got to talk to those people and understand what your technology is going to do to people on that front line. It might be great for the individual using it, but what does it mean when it fits into that system? If you're asking really, really busy frontline clinicians who are actually really worried about the patient to do something with your system that's going to take them ages, it's going to add complication to it, it ain't going to work. And that's a massive, massive point. And do you know what? Which of you guys here would like that? By the way, Dave, I've got this really cool system. I want you to use it. It's going to create twice as much work for you. You go, son. No. Why would that apply any differently anywhere else? Secondly, it's a tool. And it does annoy me sometimes when we see the hype about telehealth and things like that. It cures this. No, it doesn't. It's technology. What it can do is transport really critical information from people's home to people who can do something about it before it gets to be a really big problem. So let's stop talking about technology as being the cure for all ills and actually talk about it the way it should be, which is actually the thing that can change the way we deliver services fundamentally if we use it in the right way. And finally, it's got to be built in and around what's already there. Again, we come back to that, I've got this new system that can do everything. Right, so what we're going to do is wipe out everything that's been done before and we're just going to start from scratch because, yeah, that's what we do in the NHS. Of course it is, yeah, whatever. No. It's got to be built into the systems that already exist. It's got to fit into the way that people work and change it gradually. Yeah, we can't just start from scratch. It'd be lovely, but we can't. And these are the three things that we've really, really picked up on, because actually, naively, we go into these things getting all excited about the technology, think it's going to change the world. It doesn't, not if you take that approach to it. You've got to bring everybody with you on that journey. So, before I hand over to Maurice now, we've actually published on our website 3 reports that tell you some of that story, especially around telehealth, as to how we got to scale, but also a lot of the blind alleys that we ran up on our way, a lot of the mistakes that we made on the way, and all the presumptions that we made that actually weren't right. And when we found out what it was, we thought we'd write it down and tell everybody else about it. Hopefully they don't make the same mistakes. So I'm going to introduce Maurice now. So Maurice is one of our GPs. He's also the chair of my programme, which technically makes him my boss. So I'd just like to point out that not only is he handsome and intelligent, he's also a really nice guy. So Maurice is going to talk to you about the really key bits, because actually it was talking to people like Maurice and our frontline clinicians that taught us what we needed to know about getting the technology integrated into services.
Thanks very much, Dave. Good morning, everybody. It's great to be here, talk about So something about the programme itself. We need to remember that for assisted technologies, it's not just about the GP, clearly, although I would say it isn't. It's all about our patients, but it's more than that. We've got multiple customers for this technology. We have our patients, we have our carers, we have the clinicians, we have the GPs, the nurses, etc. We have people in call centres who are handling the data. And one of the things that we need to recognise is that all of those people need to be able to trust the system that they're working in and the technology that they have available to them. So we've got some key lessons that we've learned. We've learned that our heart failure nurses can now look after more patients because we have heart failure patients being monitored using the technology. We know that our COPD patients who are going off are being remotely monitored, and they can be forwarded on to the community respiratory team, who can get in touch with the respiratory consultants straight away to get in touch with the patient to get them the treatment as soon as they need it. We need to recognise that we're working within a very complex system. And when we're talking about integrating, we're talking about drawing all those things together. There's so many different touch points between patients, clinicians and their care pathway all the way through the system. But we need to remember what our outcomes are. What do we want to focus on? We talk about the holy grail of reducing emergency admissions, unplanned care. But we need to talk about our patient-reported outcomes. We need patients and carers to feel more confident and more secure, and they will then feel better able to self-care. They will feel happier at home and happier to self-manage, and that's what we want to do. We want to engage, trust, build trust and confidence, so that as we start to roll this technology out wider and wider, people are ready for it, they want it, and they're waiting for it. And one of the things that we've done beyond engaging with the clinicians is also trying to engage with the wider population in Liverpool via a constant programme of communications. So we've got constant comms going out via the local press, through the radio, websites, and you can see this through Liverpool time and time again. So we're building awareness for patients and carers that this system is out there and people want it. And our real eureka moment was, don't try and do this by picking up individual people here and there. Go to where our people are. And our people are in general practice. And the thing that's made the big difference between going from 50 or 60 cases of people who are on telemedicine through to our 1,000 cases is going into primary care and building the trust with the GPs and the nurses, and then phoning the patients and telling them about what's going on and engaging them in it. And not only have we got 1,000 people on the system, we've got 2,000 people waiting. And if we look at our system across Liverpool, we know from our risk strat, going back to some of the stuff we were talking about before, we've got probably 1,500 patients at 70% risk or more of going into hospital in the next 12 months. Now, if we've got 1,000 patients already on telemetry and we can get up towards that 1,500 number, 1,700, we can start to make a real difference because we can really be proactive. We can really head people off at the pass rather than just talking about it. And I think that's the crucial difference. So what of the future? So the slide that you can see now talks about the Healthy Liverpool programme. And the Healthy Liverpool programme is Liverpool's 5-year strategic plan. And it is Liverpool's programme, it is not the CCG's programme. It's a joint programme between the CCG and the local authority. Joe Anderson, the Mayor, talked about through his mayoral commission a system of integrated health and social care to provide the best services possible in the city. And Liverpool's CCG vision for a person-centred care that supports people to stay well and self-care and have the best care that they can in the community. And that's really key. So if we look here, we have our Living Well strategy, which is my baby. It's the prevention and self-care agenda, which I'm really passionate about. And just to move away from technology for a little bit, a plug for physical activity. If you're only going to do one thing, the single best thing that you can do to keep healthier for longer, 30 minutes of any physical activity 5 times a week, job's a good one. If we could do that in Liverpool, we would save over 400 lives every year. If we could get enough people to be physically active to those guidelines, we would save over 2,500 cases of diabetes every year. These are stunning figures, stunning. So the technology has its place, but we mustn't forget prevention, we mustn't forget self-care. But how can the technology help us? Well, we can incentivize people, perhaps. We can use their smartphones. We can use their text-based phones. We can use RF sensors. We can use cards to see how far people are walking. We can even plug them into rewards. So we're going to see a system of enhanced services in Liverpool to really promote that agenda using our technology. The self-care we've talked about, digital self-care, a menu of services, not just technology. We need to remember that not everybody is tech savvy. Not everybody has access to the internet. Yes, it's the future, but we're in the here and now. So we need people, and the technology has to support people to do their jobs better as we gain confidence, and the kids and the young people who are already tech savvy grow up. They will take this on into the future. The programme extends into community services and into hospital services. And as Dave said, we don't really have 2 hours, so we won't go into it. But I will point you to the website, www.healthyliverpool.nhs.uk. Have a look at it. It's a really good read. So what have we learned? We've learnt about the power of partnerships. The My programme is a public-private partnership. We've got the NHS through the CCG, we've got our community providers, we've got local social care providers, we've got the commercial sector, all working together for one aim, to try and get this stuff out there, build people's confidence and enable them for the future. So thanks very much.